Every year, Canadians come up with New Year's resolutions, and many of those revolve around exercising and eating healthier and doing other things to live in a more healthy way. And every year, many of us stray from those plans. According to a recent story from ABC News in the United States, by about mid-February, 80% of people that set New Year's resolutions, they've already broken them. So obviously it's a problem. And when it comes to unhealthy living, those consequences can be pretty significant when you look at the end result, how it impacts the healthcare system. So here's a stat from the Public Health Agency of Canada. They had a report in 2013 with some pretty startling numbers. And they noted that if Canadians lived healthier, if we exercised more, quit smoking, ate healthier, and so forth, 80% of premature heart disease could be avoided. 80% of type 2 diabetes cases and 40% of cancer cases could also be prevented. So there's huge, huge benefits if we can all decide and figure out how we can live healthier. And that's what we're going to talk about today. What are some tips so that we can stick with our dietary goals and our fitness goals and so forth? Now, my first guest is going to talk to us about the former, the fitness goals. John Weston is the president of the Canadian Health and Fitness Institute, and he's got some ideas to share with us today. John, thanks for taking a few minutes to talk to us. Wondering if you could start off by just giving us the big picture goals. What should Canadians be doing in terms of exercise each week, and how many of us are actually meeting that threshold?
Well, Colin, thanks for having me on. I love the images that are played as your show unfolds, the Canadian flag and pictures of obviously healthcare situations. There's no more pressing issue for most people than their health, and they understand it when they lose it. Unfortunately, the trends in Canada have been negative in many cases. We often think that people are living longer. But longevity isn't what really determines the quality of life of Canadians, and most people want to live healthier. Peter
Mhm.
Attia, the Canadian American physician, has written a book called Outlive, where he makes that point really well. He's got a podcast that many of your listeners will have picked up. Canadians are now looking at 150 minutes a week is the Public Health Agency of Canada number, which is a minimum to aim for in terms of vigorous physical activity. And something like 82% of youth are not hitting that goal, and it's over 75% of adults. The trend is really disturbing due to labor-saving devices, due very much to our evolution of culture, due to changes like the stripping out of the participation awards program that was in schools in the 1970s. That was a sad
Mhm.
error. So at every turn, we see that there are disincentives that discourage us from doing physical exercise that can keep us healthy in the long term.
And I talked about it in my opening comments there about some of the consequences to the healthcare system. I mean, obviously disease and that, but I'm wondering if you could expand on that. What do you see as some of the sort of immediate consequences to our daily lives from not getting enough exercise versus some of the end more significant consequences as well?
Well, the consequences are an increasing trend of overweightness that goes from sedentary behavior. And then from that, you have diabetes and cardio disease that are in the upswing. Increasingly, we're aware of mental illness problems. So you get loneliness leading to mental illness, leading in many cases to substance abuse, skyrocketing healthcare costs. The estimate is something like $7 billion, up to $25 billion, depending on how you measure it, of unnecessary healthcare costs that relate to sedentary behavior. We see that twice the number of our youth of a generation ago are overweight or obese, which means that they are 14 times more likely to suffer a cardiac event by age 50. So the issue isn't so much where we are, but where we're going and where we've come from. And the trends don't look good.
Yeah, no, it's obviously some very disconcerting numbers there. When we come back, I want to tap into what the tips are, John, because so often, like I say, many of us start off with good intentions at the beginning of the year. We're trying to go in the right direction, but then obviously we get derailed for one reason or another. And I know that your organization's been working on that. I also want to give you something to think about when you come back after the break. I want to get your advice, John. If you're made the Minister of Health to deal with this problem, what would you do? So we'll come back
Mm.
with that and more, as well as looking at the dietary side of living healthier in just a moment.